This MVI training program is a complete 9-part course on the GMP of logistics. To gain maximum benefit, we suggest that the parts should be shown separately, and at the end of each there should be a discussion on the relevance of the information and its implications to your specific activities. The MVI training qualification test should be completed at the end of the course. People call them drugs, to others they're medicines, but whatever you call them, they're the pharmaceutical products, the pills, creams, injections, and thousands of other medications and healthcare products that are designed to prevent sickness or disease, or assist with their diagnosis, their treatment when they do occur, and then, of course, to alleviate the pain and suffering they bring with them. Now, the manufacture of such products is closely controlled by government-appointed regulatory authorities such as the FDA, the U.S. Food and Drug Administration, the MCA, Medicines Control Agency in the United Kingdom, and similar bodies in virtually every country where healthcare products are manufactured. They all follow the principles or rules that sometimes are called current good manufacturing practice, or, as we'll use throughout this program, the shorter GMP, which stands for Good Manufacturing Practice. There are, in fact, just 10 basic GMP rules, so let's run through them, starting with the fundamental principle that every action will be undertaken only by following current written instructions. That raw materials must be stored and handled correctly, and that exactly the right materials must be used at all times. That all facilities and machinery are correct for the purpose, and that they and the environment in which they are situated is properly cleaned and appropriately treated. That quality control is undertaken at every stage of the storage, handling, production and packing cycle. That both production operators and support staff must dress and behave as required, be properly supervised, and, above all, be trained correctly. That all work must be undertaken precisely and accurately. That contamination of materials by either physical or viable, that's microbiological sources, must be prevented at all times. That only the specified materials are mixed. That everything is labelled at each step, and finally, at every stage, that accurate and clear records are kept of everything, of every process, and then checked to be sure that it has been done. The GMP definition of quality is that the product must reach the consumer, perhaps we should say the patient, fit for its intended purpose. And GMP rules are designed to control the quality of the manufacturing process so that the product is precisely to specification every time. But let's just examine this idea of product quality in a little detail, because it's not all that many years ago that manufacturers first made the product and then, when it was finished, maybe tested it for quality. The variable, sometimes poor quality of drugs that could result from this approach meant that medication often caused fever or a deterioration of the patient's condition, and even subsequent death. Unfortunately, then and now, it's not practical to test most medications after production, because in order to test them, you have either to destroy them or render them unusable. By the second half of the 20th century, heightened social responsibility brought with it widespread government regulation over most aspects of our lives, with the regulation of drug manufacture, thankfully, a welcome development. Expectations now are much higher, and we assume that everything we buy will perform exactly to specification, a condition brought about by the adoption of quality assurance, which means simply that at every stage the product is manufactured to a series of pre-planned operations or processes which, individually and together, have already been proved to work, or, in GMP terms, have been validated. GMP is just that, a quality management system comprising pre-planned, start-to-finish standard operating procedures called SOPs that, when followed exactly, assure us that each product, in every batch, will be precisely fit for its purpose. Actually, the same or very similar rules apply to a much wider range of products than those we mentioned earlier, and includes all the medicinal products that are prescribed by doctors, as well as those we buy over the counter in the pharmacy or supermarket. They include all those things we take by mouth, those that are applied to body openings, such as our eyes and ears, and of course to wounds. Similar quality rules apply, for example, to medical devices, the gases used for anesthetics during surgery, and, quite rightly, even to many toiletries and cosmetics. They all have a common quality that, when they reach the customer, they must be fit for their purpose. So, what does this fit for its purpose really mean? Well, if you were in need of medication, you would expect it to be precisely as prescribed for the medical condition you were suffering, whether that be coping with a headache, maybe controlling diabetes, or even a life-threatening disease. You would expect it to have been made properly, to the right, that is, the necessary strength. In addition, for your safety, it should be free of any contamination, which means contain nothing but the specified ingredients, must not have gone bad or deteriorated in any way, be in the correct container, correctly labeled, and obviously the container should be properly sealed and protected from mechanical damage during its travels from factory to patient. At this point, we can almost hear you say, but all that is a problem for manufacturing. I work in the warehouse. Okay, that was to give you the background. Now let's move on so that by the end of this program, you'll understand why and how GMP is an essential part of your job in logistics. Traditionally, logistics was the term used by the military to embrace the procurement, maintenance, and transport of materiel. Now it's used as a one-word description of similar commercial activities which separately we call storage, materials handling, and distribution, all three of which are subject to GMP regulatory control. We work in different places and countries and often call the same things by different names, so let's examine each of these in a little detail. To store something is to hold it safely for future use, and in the world of GMP, this applies to both the manufacturers and specialist packaging companies, where the products are usually segregated into separate sections and, ideally, occupy different physical facilities. They handle inventory of different types. For manufacturing, this will be the starting materials such as bulk powders, granules, and liquids that form the ingredients, or alternatively, if the operation is just packaging, the bulk finished product. Whichever is the case, they will also receive the appropriate packaging and labeling materials and store the lot until needed to complete the entire production and packaging process. On completion of the manufacturing process, the next stage is to receive these goods from the production department and to hold them safely in stock until shipping instructions are received. some manufacturers hold their own inventory of finished products and sell directly to those who deal with the patient, such as hospitals, retail pharmacies who dispense prescription drugs, and they and other retailers who sell healthcare products over the counter. There's a growing trend for manufacturers' inventory to be held by specialist intermediate logistics contractors, companies still under the GMP regulatory eye that receive finished products, hold them safely in store, and ship them when instructed by the manufacturer's sales department. Most manufacturers distribute some or all their products through wholesale distributors or dealers, who buy the inventory for storage in their own warehouse and then undertake sales to the hospitals and retailers. Products distributed by them are subject to identical physical controls, the only difference being that they own the product while it's on their premises. A common factor between the stores of logistics contractors and wholesalers is that they will hold products from several companies, while the manufacturer's warehouse will almost certainly only hold its own product. Regardless of their function, the stores or warehouses of manufacturers, logistic contractors and distributors have a single purpose, namely to receive goods and materials from outside, to hold those goods and materials in storage safely, and to ship them out and transport them without damage on the next stage of their journey. We saw earlier that GMP codes control the manufacture of every medicinal product so that it's the right strength, is free of contamination, must not have gone bad or deteriorated, is in the correct container, is correctly labeled, and that the container is sealed and protected against damage. Obviously, many of these requirements are beyond the direct influence of many logistics operations, but equally many are not, and GMP guides are clear on the facilities that should be employed. To start with, the premises in which materials and finished goods are stored should be located in an area where the risk of contamination from adverse local environmental conditions is low. The buildings should be of sound construction, maintained in a state of good repair, provide protection against the weather and the entry of insects and other critters such as vermin and birds. Weather protection is essential at receiving and unloading, as well as loading and shipping bays. In addition, storage areas should always be in a secure state, with entry permitted only to authorized personnel. The environmental conditions within the warehouse must be appropriate for the materials and goods in store. For example, heating, lighting, ventilation, and humidity should not affect the quality of these materials, while, of course, being comfortable for staff to work in. The rules say that warehouses should be big enough to allow for the storage of the different types of materials to be housed, which, for a manufacturer, includes the starting materials or raw materials, packaging, usually of many types, bulk products waiting finishing, and ready-for-use finished products. In addition, the storage of many of these items must accommodate their different operational status, such as approved, in quarantine, where materials may be subject to further quality control and then either released or rejected, returned, or, hopefully rarely, recalled, both of which we will look at in detail later on. All GMP rules are important, and rarely is one more so than another, but in terms of logistics, selecting the right material is high on the list of critical factors, using a method called first in, first out, usually abbreviated to FIFO. FIFO ensures that stock rotates and that the materials and products that have been in stock for longest go first. FIFO applies to all three categories of stores or warehouses because, more often than not, both the raw materials used in the production of drugs and the drugs themselves have specific shelf lives, after which they can deteriorate and lose their effectiveness. GMP is one of several quality management systems. Another is the ISO 9000 International Quality Standard, or the FDA's Quality System Regulations for medical devices, and all of them require a quarantine area in stores. This is space allocated to the storage of usually incoming materials, waiting verification or testing. This quarantine area should be clearly marked, secure, and accessible only to specifically authorized personnel. A few moments ago we mentioned that the temperature and humidity of all warehouse environments must be appropriate to the products held in them. And, of course, some products must be kept at very low temperatures in special cold stores, which are basically large refrigerators, while others, such as powdered, freeze-dried drugs that will be reconstituted with water prior to use, require extremely low humidity. Such environmental conditions cannot just be installed and left to their own devices, and must be monitored regularly and maintained to specified tolerances. In fact, all environmental systems should be validated, which means that they must be proven to meet their operating specifications and documented accordingly. This applies equally to the general environment and refrigerated or freezer units. The instrumentation installed to monitor these conditions must be calibrated and, of course, documented. In addition, some materials are toxic and dangerous, apart from which there are drugs that require special controls, both of which need to be located in areas of high security. By now, you'll understand that handling and storing GMP-controlled healthcare products requires more critical attention to detail than is needed for many less demanding inventories. And if you work in this area, although some of the requirements are things that you personally can do little about, it's important that you understand the reasons behind all the regulations. For example, the need for stores and warehouses to be kept as clean and tidy as possible is an extension of the care that goes into making the products in the first place, as is the need for the environment to be kept in good repair, a principle which extends to every person working in them, in particular reckless handling of forklift trucks and careless maneuvering with carts can both cause damage to the building and facilities in it and damage the goods being carried. Incidentally, one of the requirements, and therefore a characteristic of people working in GMP-controlled environments, is that they take a personal interest in what they're doing and, rather than turn away and saying, "That's not my business," undertake to report any discrepancies which, in the context of logistics, means reporting damage to the building, inventory, or anything else that is wrong. We probably go on a bit about security in GMP stores, but think about it. It really is a critical matter. Imagine that there's been a break-in, in which case, and obviously, any loss of inventory is bad news for the company, but equally important, consider the danger if what remains has been contaminated, maliciously damaged, or rearranged. Remember, these storage areas are to be worked in only by people who have undergone GMP training, as you have, and that applies to everyone who visits. They should never be left on their own. We mentioned earlier how important it is to protect buildings against the entry of wildlife, but we'll raise it again here. Protect against the weather, because rain, snow, and dust will all affect adversely the products in your care, and because they are also a matter of security, which means that entrances should be kept shut at all times when not in use, to stop the entry of critters of every type. It's very difficult to overstate the importance of fitness for purpose, quality as defined for GMP-regulated products, a standard that requires a very high level of precision during manufacture, which is why any visitor to such a plant will notice immediately that virtually everyone in sight appears always to be either writing or, alternatively, nowadays, entering information on a keyboard. This focus on documentation of every activity as it happens really points to how effective GMP is. The reasons for documentation are understandable because, firstly, as instructions, they enable us to be quite clear as to what we must do, and then, as records, to confirm that we've done the right thing, and so enable the investigation of subsequent complaints and/or defects to identify precisely, for example, which actual containers are in query, to determine the appropriate actions that will eliminate that problem in future. The manufacture of many products must be licensed by the regulatory authority, a condition of which is that they must carry out regular inspections, which rely heavily on an analysis of historical data to assess conformity. In addition, the company must itself undertake regular internal inspections or audits to monitor performance, and the availability of detailed records is essential. No less important, the history of what we have done to underpin what we do now gives a multi-layered direction to what we need to do in future, and justifies the apparent preoccupation with documentation. There are two types. First, the instructions, which detail what's to be done and how to do it. These are generally called standard operating procedures and referred to as SOPs for short. A few examples of the activities written up as SOPs include the receipt of materials into warehouse, or of packaged products, how to pick and assemble an order, the procedures associated with dispensing, all about protective and safety apparel, or cleaning, procedures for ensuring FIFO, the first in, first out stock rotation system. There are certainly SOPs about security of inventory while on the shelf and during shipment, as well as how to organize shipping. And, of course, there are SOPs to cover products returned by customers following complaints or as a result of recalls. SOPs will almost certainly look different in each company, maybe within the same plant, and they may even be called something different. However, what they all have in common is the need for you to follow the instructions exactly, with no exception. And remember, make certain that what you're about to do is in fact the current and therefore correct instruction. The whole point about quality assurance, and GMP in particular, is to ensure that things will not go wrong. But with us humans, mistakes and accidents can and do happen, which, after we've taken so much trouble to try to avoid them, is the reason that the other type of documentation, records, are needed as a source of future reference to what happened, why it happened, and what and how we should do better in future. Logistics records mirror the subjects covered in the SOPs and include the goods and materials that have been received and their issue, records of distribution and shipping, cleaning, special storage conditions such as inventory needing cold or secure storage, return goods, and records of complaints. The infallible rule of all GMP records is that the data must always be entered immediately as it happens, while it's fresh in your mind. Never, under any circumstances, can it be done later. SOPs often call for there to be a second or check signature to confirm that an event took place, and however much you may trust someone, even a long-term working partner, if you have to provide the check signature, you must follow this rule and personally check that it was done, because shift-end catch-up on administration is not an option. Records have to be kept for a number of years, rarely less than 5, and they must be readable during that time, so make them clear and legible. We all make mistakes, and when a record is wrongly filled in, never cover it up or obliterate it with whiteout. Merely cross out the wrong entry, make the correction, then date it, and sign it. Of course, those rules apply to handwritten records, but the same principles apply when using computers. It's claimed that 80% of product recalls are due to faulty labeling. By the GMP definition of quality of fitness for purpose, it doesn't take much imagination to realize what can happen if a very sick patient is given medication from a wrongly labeled container. Everyone who works in the warehouse or in shipping should always keep a sharp lookout for wrongly labeled products and report them immediately. So, let's look at those aspects of labeling that affect the storage and handling of GMP products, starting with internal labels. There are two types: identity labels and status labels. Identity labels do just that, and are placed on containers, equipment, bulk packages, materials containers, and etc. to identify the product being made or the materials they contain. Apart from the product name or material type, they will also show the batch number, date, and material code number. Status labels differ in that they show the current status of the product, equipment, containers, and so on, so that they may read, to be cleaned, or cleaned, approved, on test, rejected, hold, or quarantine. Incidentally, both identity and status labels can be combined in one to give all necessary information. We're going to repeat ourselves again, because every GMP rule is there to ensure that the right things are done at the right time, using the right materials and equipment, and above all, to avoid mistakes. Labeling is certainly no exception, the first rule of which is that every type of label must be handled as a fundamental component of the product and looked after just as securely. If you see labels wrongly placed or partly adrift from a container, then, if you are authorized to do so, they should be corrected or reported to someone who is. The information on all labels must be clear and readable. And here's a really important rule. Never place identity or status labels on the lid of a container, because they can be removed and then placed on the wrong container. Never stick a new label over an existing one. Always remove the old label first, otherwise the new one could come off and you've got it, trouble. These GMP rules have a specific purpose. They're designed to stop the tragedies that could and have happened when, say, the status label cleaned is put on a container that has not been cleaned. It goes unnoticed and so contaminates the next batch of a different product, and yes, you've got that one as well, more trouble. There are 3 separate stages to the GMP of logistics, which is about the handling of materials and finished products. Stage 1 is their receipt from somewhere else, and, dependent on where you are, called either incoming goods or goods inwards. Stage 2 is looking after them for a period of time, called either goods on hold or goods in stock. And finally, Stage 3, shipping them out when required as shipping, goods out, or outgoing goods. Each requires specific attention, so we'll start with goods in and examine the 3 material forms that it describes. At a manufacturing plant, most goods in will come from an external source, whether from another manufacturer or even a sister plant, and will be in the form of starting or packaging materials or as finished goods. The warehouse at a manufacturing plant will also receive goods in from the production area, either as bulk product, waiting further processes, or finished goods for holding as inventory and shipment. Distributors and shipping contractors will nearly always only receive finished goods, but from a variety of manufacturers. In addition, no matter what type of warehouse, goods in will include returned or recalled products. Receipt of goods from external sources are always the subject of an SOP which will stipulate that goods must be checked immediately and that the documentation, the delivery note or packing list received with the goods, and a copy of the buying department's purchase order contain matching information so that physical checks confirm that they are the correct goods as ordered, in the correct quantity, of the right grade, correctly labelled, in clean condition, undamaged and dry. Any discrepancies should be reported immediately. This can only be a first visual check, because the staff on a receiving dock can't be expected to carry out more detailed technical inspection. That will come later and be done usually by QC laboratory staff. After checking the consignment, receipt must be recorded, usually starting with the purchase order number, the product's internal reference number, the vendor's name, product code number, and batch number. Of course, we record the total quantity received, the number of containers it came in, and the date. Finally, as always, a verifying signature to confirm that the appropriate checks have, in fact, been carried out. If the materials received must be placed in quarantine, then this will be stipulated in the SOP, the correct status label applied, and the materials transported physically to the appropriate quarantine area. They may only have come from the manufacturing department or the packaging hall, but they are goods in just the same and must be recorded in exactly the same way, by checking the product details, batch numbers, quantities, and identifying their status. And it goes without saying that they must be handled with the greatest possible care. Products that are received back in the warehouse from external sources will be normally either returned or recalled goods, and both have to be handled with great care. Returned goods are nearly always those that have been on the shelves of wholesale distributors or retailers and sent back for a variety of reasons, such as overstocking or, say, superficial damage. They may be eligible for resale if, for example, they're in their original containers and packaging and are known to have been handled correctly. Of course, they must also be within their shelf life date and been examined by an authorized person. Recalled products are another matter, and the subject of recall notices initiated by the company when, after release, they are found to have been wrongly made or wrongly labelled. As you will appreciate, this is an extremely serious problem, and will be the subject of an SOP that details every step that must be taken in the plant, in the warehouse, and by distributors and retailers. Recording all the appropriate data is even more important with recalled goods because the packaging is nearly always in perfect condition and it's so easy to put them back with perfect stock, with easily imagined consequences. Goods in hold comprise either the raw materials, often called starting materials, which form the constituent parts of the end products we manufacture, plus their packaging, such as containers and labels. Or they are the finished goods themselves. Whichever form they take, they must be stored neatly and tidily, and be easy to get at. They must be labelled to show their identity and status, and any shelf life or retest dates that apply to them. Warehouses that hold GMP inventory are designed and built to protect the products from the things that affect them, such as forklift trucks that need plenty of space to give their drivers room to maneuver without causing damage. Damage is caused by dampness, therefore ensuring that water is kept out is essential. Some products are affected by light, which is why they are packaged in coloured containers, while many are temperature sensitive, which is why cold stores are installed, usually required to keep the product at between 2 to 8 degrees Celsius, that's 36 to 46 degrees Fahrenheit. Most product, though, is kept normally at temperatures of between 15 to 25 degrees Celsius or 59 to 86 degrees Fahrenheit. If you work in a warehouse and have done all the things you're supposed to do with the materials and goods you handle, then there's not a lot more you can do. However, even if it's not your direct responsibility, you can keep your eyes open and act when you see damaged or spoiled goods, damage to the building or racking system, security breaches, in particular strangers in the warehouse, obvious changes to temperature outside the normal limits, and labelling faults, and anyone not using FIFO, e.g., who is picking the latest in rather than the earliest stocks. Goods out or shipping applies equally to materials being issued to manufacturing and packaging departments and the shipping of finished goods for distribution. As usual, we'll examine each of these separately and stress again that the issue of raw or starting material to production must be undertaken as a precision exercise. Instructions will detail exactly what must be issued, and records must be made that this has been done precisely. The materials that comprise GMP-regulated products nearly always contain powders and/or liquids that must be dispensed in precise volume. In addition, they may well be potent or, like the antibiotics and anti-cancer drugs, very toxic and poisonous, and dispensed in controlled and filtered environments. At the risk of endless repetition, the issue and dispensing of raw materials must only be done by strict reference to the SOP and by people who are qualified to do so. If you are authorized to dispense and handle materials, you should always wear the specified protective clothing, which may include masks and eye protection as well as gloves. This is not only to protect you from possible ill effects, but, just as important, protect the product from any contamination you may disperse. In addition, you must check that the air handling system is switched on and working correctly, that the whole area and its equipment is properly cleaned, that all scales or balances are correctly calibrated. When it comes to the actual dispensing, the first thing is to check that you are using the correct material, that the batch number is correct, and that it's not past its shelf life date. Obviously, you'll check that the bulk container from which you are taking the material is not damaged, and equally that the container into which you are dispensing is in a clean and fit state. The actual weighing and dispensing should be done with the minimum of movement to limit dust, and when done, close and label the container as detailed in the SOP. If material remains in the bulk container when the batch has been completed, it should be carefully sealed and returned to inventory. It's no surprise that when the task is finished, the record must be filled in to show what it is, the batch number, and quantity dispensed, all completed with the signature or initials of the person who did the job, together with those of the person who checked it. The final stage in the whole GMP production process is to ship product to the distributor or user. We mentioned earlier that this may be to a distribution warehouse, to a retailer, or to a hospital. This requires picking the correct items from their shelves and assembling them against the order documentation. We can only say, again, that it's necessary to pick the exact items that are specified, check that they are not time expired, ensure that the customer's name and address are correct, and that all the details of the consignment are correct. And if you're the one who has to transport these products, remember that it's essential that the identity of each of them is accessible, that they are not spoiled, don't get contaminated or allowed to contaminate another product, and that they are protected against breakage or, if appropriate, against spillage. And finally, yes, finally, if you are driving a temperature-controlled truck or van, please make certain that it remains at the right temperature, so don't turn off the power to the chiller unit. And that's how the GMP of logistics fits in with the complete production chain of making life-saving healthcare products. Let's review it before you do the test paper. The manufacture and handling of medicinal and similar products is regulated by government agencies. This is achieved through following the rules of Current Good Manufacturing Practice, CGMP for short. There are 10 basic rules, with the most important that every action will only be undertaken by following written instructions. The GMP definition of product quality is that it will be fit for its purpose. Logistics for the purpose of GMP covers material handling, storage, and distribution. It applies to manufacturer, specialist packaging companies, and distributors. Stores and warehouses should be secure and resistant to adverse weather conditions and animal life. Internal environmental conditions can include heating, air conditioning, lighting, and humidity. They must be able to handle raw materials, bulk and finished goods, rejects, returned and recalled goods. Inventory must be stored and used in FIFO, first in, first out order. Quarantine areas for the storage of materials waiting release must be separate and secure. Stores and warehouses may also need to store inventory in cold room, and also materials that are dangerous, toxic and controlled. People working in GMP environments, including the field of logistics, have particularly good working characteristics and note and report discrepancies that may not be in their direct control. Documentation, usually in the form of standard operational procedures, SOPs, tell us what to do, and records what has been done. Historical data, often stored for a minimum of 5 years, provides information to check on past problems and to enable remedies to be devised. All documentation must be completed legibly, with check signatures to verify each activity. 4 out of 5 product recalls are due to faulty labeling, so always check the correctness of every label. Internal labels are either identity labels to show the details of what something is, or status labels to show the stage the material is at. All types of warehouse have 3 stages of activity, starting with goods in, goods on hold, and finally, goods out. Whatever your job, be neat and tidy in all you do. Follow the instructions exactly, and record everything precisely. Some people call them drugs, to others they're medicines. But whatever you call them, they're the pharmaceutical products, the pills, creams, injections, and thousands of other medications and healthcare products that are designed to prevent sickness or disease, or assist with their diet.